Malnutrition is still persisting in India, especially in the form of stunting and wasting. And repeatedly, many research studies have shown how mother's weight and mother's BMI is directly influencing the birth weight and the right appropriate weight for gestational age. So if we improve mother's weight before she conceives, because by the time she gets all the government programs, she gets enrolled into ICDS, it is around 12 weeks or 13 weeks, by the time most of the organs are already developed and the fetus is already growing. So we have to place lots of emphasis on preconception counseling. That should be made mandatory. Young, newly married couples should be counseled regarding the important significance of nutrition as well as health during that period before the girl gets conceived, and also appropriate age, because many girls get conceived below 18 years old or below 17 years old. So the right age and good nutrition status and screening for health and appropriately treating them for that will definitely improve the birth weight. And once we improve birth weight, there is reduction in stunting and also wasting levels. This has been shown repeatedly by quite a few studies, and this is the major weakness in our country. The other one is, of course, the first 1 or 2 years feeding practices, which needs to be improved. Dietary diversity needs to be improved in young children right from 6 months to 2 years old. Nutrition sensitive approaches, we have to, of course, improve accessibility and affordability. When we ask them to take good nutrition, nutritious food must be made available, accessible, and also affordable, because most of the nutritious foods are quite expensive. Apart from that, education of mothers is extremely important, because repeatedly our surveys have shown wherever mothers' education is poor, consistently the nutrition status of their children happens to be very poor, take in terms of stunting or wasting. So we need to improve their education, and of course, wash and hygiene, sanitation, these also play a very significant role. And of course, government's focus is also there on improving sanitation and water supply to every corner of the country. And particularly improving girls' education will play a very significant role in nutrition outcomes. National Institute of Nutrition has always played a very significant role right from the beginning, inception of our institute itself. We have always given the nutrition norms, like how much calories and how much protein should go into the plate of the child or pregnant woman or lactating woman. That way, NIN has played a significant role, and recently we have published in 2017 our nutritive value of Indian foods, that is food composition table, which gives very clearly the macro and micronutrients in the foods of 160 macro micronutrients and 560 foods from different corners of the country. And this is widely used for nutrition synthesis, nutrition recommendations, and many policymakers, education and advocacy, and also by students. And recently in 2020, we have released the nutrient requirements for Indians. And for the first time, this particular release includes not only recommended dietary allowances, but also estimated average requirements. And these metrics have specific use in the book. So in our policy. So this estimated average requirements and RDS have a very special role when we design fortification strategies, and when we also look for front of pack labeling and by industry also. So that way, NIN has contributed hugely. And also we have developed the My Plate for the Day, which was released by the Vice President of India in 2019. And this My Plate for the Day has been very popular among population. It is very easy to understand. Food-based recommendation, like what is healthy, how much your plate, how much vegetables and fruit should go into your plate for a day. So it's a very legible, easily given plate, easy to understand even for a lay. Corporate sector, yes, has a very significant, can play a very major role, particularly with respect to food industry. The public-private partnership is very poor right now, not grown to a large extent. Food industry can play a very major role by making changes in their packaged foods to healthy foods and beverages also with respect to food industry. This is health industry also. Like, for example, when big nursing homes and hospitals are there in the city, probably they can also set up smaller level clinics in the tribal areas and rural areas and help the government in reaching the innermost segments of our population. and also mobile industry. Mobile industry can also play a very significant role by incorporating certain apps which can educate the people about nutrition, and which can also educate about simple cares like mm, uh, screening for hypertension and diabetes, because hypertension and diabetes is increasing at epidemic proportion in our population, and most of them are not even aware. So that way, the mobile phone industry also can play a very major role. And each industry also, not many industries are aware that their productivity will decrease actually if a person is undernourished or overweight obese. These malnutrition spectrum, right from undernutrition to overweight obesity, can play a very negative role on the output of the people, employees. So if they have a regular counseling session for their employees with respect to good nutrition and appropriate physical activity, that will improve not only physical output, productivity of the company, but also like where innovation is involved. I mean, high fat food, all these overweight, obesity can make your cognition slightly affected, and your productivity also will be affected. So each industry can, if they take up, I mean, see, we have 500 million employees workforce. So 28% of 26 or 28% of that is in the production industry. So if each industry can take care of their employees, they are quite contributing significantly to the country. Poshan 2, which was launched very recently, encompasses not ICDS, creche facility, adolescent nutrition, various other aspects under one umbrella. And with this respect, Outlook Poshan magazine is doing a great job spreading messages through social media about nutrition to every stakeholder in the country. That way, Outlook Poshan magazine and the initiative taken up by this Reckitt company is doing a great job by reaching every child in the country.